Hello, many of you are probably wondering what prediabetes is all about. I'd like to start off by saying prevention of diabetes is possible. Are you ready for the challenge? Let's look over the risk factors for diabetes one more time, and keep in mind that we are talking about primarily type 2 diabetes, which is the most common form of diabetes in adults. Again, there is a common theme. We've talked about this before. Unhealthy food habits, not enough exercise, or no exercise at all, excess weight, smoking, excessive alcohol, stress in life, and factors such as family history, the genetic structure of Indians, which makes us more prone for many of these chronic health conditions such as diabetes, heart disease, and so on. Taking certain medicines can increase the risk for getting type 2 diabetes. Gestational diabetes, if a woman has had diabetes in any of her pregnancies, or if a woman has a condition called polycystic ovary syndrome. I'd like to talk about a very important risk factor for diabetes for people living in an urban setting in India, and that is living in a metro. Most people are living in apartments without any walking or jogging tracks, without any space for exercise, and unfortunately these places do not also have any space for kids to play around, which makes matters even worse. And there aren't any safe places for women to exercise in or near most of these apartment complexes. Most jobs are sedentary, meaning no room for physical activity at work. Housework is minimal for many stay-at-home moms, as maids get all the exercise. For working couples, there is no time to cook, which means frequent visits to restaurant, frequent takeout food or fast food, and overall many people living in the metros are imitating the bad eating patterns of the West. All the very bad, very unhealthy Western fast food is gaining rapid growth and popularity amongst the Indian youth and even the working class. Now, these foods tend to have very low nutritional value and very high calorie content, only adding to the problem. Lifestyle tends to be highly stressful for various reasons. Commute times are long, traffic problems every day, no time to relax or enjoy nature. And I believe that TV is making matters even worse in most cases. TV, I should say also the internet, when people spend a significant amount of their free time in front of these objects, what ends up happening is that we tend to become even more sedentary, which in turn is going to increase our risk for developing many of these chronic health conditions that we've been talking about. So how do we find out if you have prediabetes or diabetes for that matter? Simple. All you'll have to do is just one test, a fasting blood sugar test after an overnight fast. After a 10 to 12 hour fast is what is recommended. So typically the best time would be first thing in the morning. So if the level is less than 100 milligrams per deciliter, you can say that the test is normal, which means that you do not have diabetes. If the level though is between 100 to 125 milligrams per deciliter, that means you are at risk for getting diabetes. If the level is 126 milligrams per deciliter or more, that means you have diabetes. Now, you will always want to redo the test on a different day for confirming the diagnosis, and you can talk to your physician about that. Another blood test called hemoglobin A1C can also be done to diagnose these conditions. I have discussed this in detail in the topic type 2 diabetes part 1. So pre-diabetes, what exactly does this mean? We just talked about the at-risk individuals with blood sugar, fasting blood sugar between 100 to 125, such as fasting blood sugar reading of 112 or 124 or 118. So that is pre-diabetes. Hemoglobin A1C is another test that can also help detect this condition. If the level is between 5.7 to 6.4%, that indicates also that you have the tendency for getting diabetes in the future. If you find out that either of these tests, say you have them done and they are showing that you have the tendency, that you have pre-diabetes, this in fact is good news. And you say, how? Well, now you know that you have the tendency for developing diabetes, so you take the right steps and prevent the onset of diabetes. Now what will you need to do? Lifestyle must change for better. Food and diet, home cooked food is the best. This is my slogan that I strongly believe in. And make sure that you make healthy food at home with less oil. Eat lots of greens, green leafy vegetables, all kinds of vegetables. Avoid fast food and junk food as much as possible. And eat sweets and bakery items in very limited amounts and only occasionally. And one small tip that I'd like to give you is every meal that you eat a bit less than what you're used to. Try this out, maybe one less serving, or making sure that you get away from the table before you are completely full. Also practice stress relief and make sure that you devote time to physical activity. Walk wherever, whenever possible. Stay active. Do not sit for long periods. Go ahead and stand up, move around, and do some activities around the house. You'll burn some calories, and that counts for physical activity too. Gardening, if you have a independent house and you have a small garden or a big garden. Cleaning, and just staying active, moving around. And if you have kids, small kids, play sports, play games with them, and spend time with friends and family. And this is very important, I believe, that you have no TV. Yes, activity days, at least twice a week. You try this out a few times and you'll realize how much free time there is when you do not watch any TV. You do not watch TV and you do not let your kids watch TV. And practicing yoga, practicing meditation, and making those a habit will go a long way in relieving your stress level and also help keep you alert and active. What next? Check your weight, check your waist circumference every month or so. Look for improvement. If there is not any big change, maybe you'll need to pay more attention to your food habits and increase your activity efforts. And I've mentioned a few more things in the topic obesity that you may want to review. If you're going to go see your physician, make sure that you ask questions and also find out if there is any need for medicines. In some situations, medicines are prescribed. Then again, for many others, they may not be necessary. Smokers, stop smoking. And if you drink alcohol, I would suggest that you quit. Make sure that you repeat the blood test for fasting blood sugar or the other test, hemoglobin A1C, in a few months to see if there is any improvement. And I'd like to end by saying, come on, get the test done. Everyone, get your fasting blood sugar checked in a good lab at least once every year. If you have pre-diabetes, do it more often. And encourage all of your family members, all adults in your family, to get tested for diabetes also. And know the levels for normal, pre-diabetes and diabetes range for blood sugar. You can prevent diabetes by just following some very simple steps. Eat right, stay active, exercise, lose weight, avoid eating out often, and reduce your stress level. Thanks for watching.